that been the case?
Military One Source came on while I was active duty 2005, so close to 11 years now. Yeah, and there was these huge briefings all across the Air Force and all across the Army where we had to sit and we had to look at the site and it taught us how to use it. And of course, like all things new, no one touched it. No one touched it. And they were like, okay, guys, this is here for you. There's money being poured into this. If you need it, no one touched it. Then I don't remember exactly what happened. There was a particular conflict I remember overseas. A lot of lives were lost. And that's when they seen the first kind of spike in Military One Source. I want to believe it was 2008, the year I moved here to San Antonio. And once people saw it and started using it, they realized it was quote unquote safe. And then it's picked up traction since then.
So what modality are you using for children and parents with PTSD?
I honestly have not had a lot of parents with PTSD. Maybe one, maybe two. It's not something I see a whole lot in my practice. I see a lot of teens and children with behavior issues as a result of just moving, deployments. Deployments are slowing down, despite what's being said on TV and things like that. Parents may deploy once and that might be it. There's not a lot of that repeat going every year. That's not happening a whole lot. So as far as the PTSD realm, I don't see a whole lot of it. Like I said, maybe one, maybe two, but it's not the big wheel. A lot of it is behavioral. And then that's when it kind of comes out. I didn't want to move. You made me move. I hate you. And it's like, okay, here's what we're dealing with. We got that kind of situation going on.
So if you were going to, what would be your preferred?
My preferred would probably be narrative. I wouldn't want to be very goal-oriented or goal-focused like solution-focused therapy does. Maybe even some collaborative therapy, which has worked a lot in the past. I've seen with PTSD clients when I was at the Rape Crisis Center where I spent some time. But I would pull probably from narrative. There's also a couple of older therapeutic modalities, if you've ever heard of Gestalt therapy. I remember a few times using empty chair technique with a couple of PTS victims, and it was unlike anything I'd ever seen before. And there was some real breakthrough there, especially some people that I got to work with early on that were dealing with survivor guilt as a result of their PTSD. Like I said, I haven't had a whole lot of experience with it, but the few times I did, I remember using narrative therapy and pulling a little bit of some Gestalt techniques.
Yes, ma'am. I'm curious about your work with parents. What sort of techniques do you use to help them understand or kind of work with their kids who are going through these transitions or acting out at school?
That's a great question. So if you didn't hear, what are some of the techniques that I use with parents that are dealing with kids that are working with some of these transition issues? One of the biggest things I've learned in working with parents that are dealing with children that are having a hard time understanding. Parents don't have the same understanding. It's almost like we forgot what it was like to be a child or a teenager. Like we forgot what it was to want to dress like 5 other people at one time. Or what it was like when my boyfriend did not write me a letter back, and it was write a letter, right? Because you didn't have no text message at that time. It's almost like a lot of parents forget that. So some of the things, the first thing I do is I work with the entire family. Then I separate. And sometimes I'll give like a questionnaire and everybody's answering the same questions, and I switch it up, and then there's this light bulb that goes off with these parents that says, I had no idea my daughter felt that way. I had no idea my son felt this way. And when that understanding comes, the parent seems to be so much more open to ideas. How can I do this? First and foremost, start talking more to your child. Have these conversations. So don't allow that kid to just go in that room and close that door like teenagers have a tendency to do. You follow right behind them and start having conversations, because the more conversation and communication you have, you'll develop an understanding of why they're feeling what they're feeling and what your role can be as a parent. After understanding, support. Helping parents to support their children. And you have to support them because guess what? They can't go back, right? I can't reverse what happened. This is where we are. I know you hate this neighborhood and you don't like the new school. What's a way that you can be supportive? Dad, if this kid has some type of event, be there. You know it's already difficult for them. Be there to support them. Encourage them in whatever it is they're wanting to do. Whether you don't like it or whether you think it's a waste of time, encourage them. That's one of the big things that I've been seeing with some parents here lately, because their teens are engaging in some activities that they're not very fond of. Music that they're not necessarily fond of, which I'm like, hey, whatever you let your kid listen to, that's on you. But if this is something that your child is passionate about, something that your child loves, support them. Don't tear them down and say, hey, you shouldn't do that. That's a waste of time. That's stupid. You're never going to get into college with that. Don't do that, because when you do that, trust and believe, they will never tell you anything else. So when parents kind of get that realization that some of the things they've been doing and saying, all in the name of good parenting, has been isolating their child, they start kind of bringing it back in closer. And I've had a lot of success with parents kind of having this eye-opening moment when they realize how distant they actually are from what their kid is going through. And when they do, we just offer a lot of support to be able to tell that parent, here are some things you can do to bridge that gap, to start encouraging and supporting this kid that's in this new place they don't want to be in. I hope that answers your question. Very good. Very good. Yes, ma'am.
When you're billing insurance to work with someone with kids, what do you find? What are some of the diagnostics that you're finding yourself?
A lot of adjustment disorder with depressed moods. They do show a lot of symptoms of that. I've had a few times where the situation's been rather intense and I've had to diagnose oppositional defiant. No bipolar, no depression. I used a few Z codes, child being separated from parent, upbringing away from parent. That kind of supports the diagnosis and supports some of the things that I'm learning as far as my notes are concerned. But for the most part, it's an adjustment disorder that I see a lot of the kids in. It's a good question.
I wasn't a military child, but we moved a lot growing up. And one of the things that I found is that you are very resilient and very strong, and you make friends easily because you've learned how to do that. You morph into whatever it is you are. But those long-term relationships is a difficult thing. You know, even within your own family sometimes, because you're used to, okay, I'm going to start over again. You know, and I can be somebody else, and I can just wipe the slate clean, and everything I did is there, and here I am starting again. And so as life goes on, you have to realize, you know, I mean, it would have been easier if somebody had pointed that out, or I knew that early on.
A little bit early on. You're absolutely right. That's a really good point, because we do kind of learn that, right? And one of the things that we would say when we get to like duty locations, or if we're working in units that we don't like, it's only temporary. Nothing in the military stays. I can endure this jerk for a boss for a year, because in a minute I'm going to be gone. And when I'm gone, I get to start off fresh. And whatever it is I want people to know about me is what I get to put off. One of my favorite aspects of social psychology is impression management. I get to manage what I want you to think of me. All I have to do is create it. And the military gives you an opportunity to do that 6 different times. So if it gives you the opportunity to do that, guess what it's teaching your kid? Just move and start over and do something else. So that's when it becomes very important as a parent to make sure that you lay the foundation properly for your children, to say, this is who you are. This is who you will how you will carry yourself, no matter if we're living in California or if we're in Egypt. And have that grounded foundation into that child, so that they know that, yeah, you're going to change a little bit, right? Because culture is going to just kind of force that up on you. But who you are, stay true to who you are. If you don't like those things and the other kids do, it's okay for you not to like those things. You're going to come across people who do. And parents that are able to have those conversations with their children really tend to adjust a lot easier, and they don't compromise who they are to fit in. And a child that can learn that, I mean, as adults, we still compromise who we are to fit into a situation. I can tell you, when I first got this oxygen tank, I would hide it in a backpack, because I didn't want anybody to look at me. And I'm 32 years old, so I can only imagine what a 14-year-old experiences when they walk into a room of people who are already passing judgment, because that's just what we do as people. But if that child is grounded in who they are, they walk into that room with their head up, and it doesn't matter what anybody else says. That's taught at home. Yes, sir.
How do you help the children educate the people that say negative things about the military? Because they don't know. They don't know what kind of jobs. They don't know there's a ton of different jobs, a variety of jobs.
That's interesting. When we were preparing, my business partner and I were having that conversation. A lot of that, I believe, this is Aisha speaking, has to do with how a parent educates their child on what it is they do in the military. The conversation I would always have with my brother and sister is, I work on computers. So when people always ask, well, D5 pains, and my brother and my sister knew, no, my sister works with computers. She sets up computers in new places. That was my job. So they had the ability to say that, and there wasn't this kind of back and forth, and kids didn't necessarily, oh, okay. And that was just kind of the end of it. But then you have in the military some jobs that are considered top secret. There was a season where I worked and I couldn't tell anybody what I was doing, what I was working on. It was only about 6 months, but my job shifted at that time. Was it necessary for me to sit my kids down and say, look, I'm doing something different, guys. Don't tell anybody. Not at all. Not at all. Not at all. And you do have jobs like Intel. And things of that nature where what you're doing is not something that you can discuss. As a parent and as a caregiver, the same way, parents and caregivers tell their children, well, I'm a police officer, I protect. Or, I'm a judge, I make decisions on law cases. Military members should do the same with their children, to take that kind of what's already going to be a shaky start or, kind of a nerve-wracking moment for that child. Remove some of that from them. Remove some of that anxiety. You tell your friends that dad does this, or you tell your friends that mom does this. And it really does benefit them in the end, because they don't feel any kind of way about it. Yeah, my mom's in the military. She does computers. My brother would say that my sister does computers. And then he would come in after school. He's like, hey, my friend's laptop is broke. Can you fix it? Hey, dude. I get paid for this. This is not a hobby. Not a hobby, little boy. Interestingly enough, I find it more difficult to tell people that I'm a therapist than I did when I was in the military. It was nothing to say, yeah, I'm in the military, I work on computers. When I tell people I'm a therapist now, oh my God, I need to see someone. Not right now at Applebee's, you don't. It's not imperative. It's not imperative at all. Yeah, so I've learned my lesson on telling people that one. Military is much easier. Much easier. Any other questions that I might be able to answer for you? Yes, ma'am.
I'm wondering if you're seeing any kids and some backlash of these welcome home videos that we're seeing on the news all the time of the father or the mother coming home early or meeting the child at school and surprising them. If you're seeing anything from kids who are like, well, wait, that's not my parent.
I've never once heard that or seen it. There was a young man here at, I don't remember the middle school. His mom came early and surprised him at the basketball court, and it was so well received by all his buddies. And most of the kids at that school are military. I want to say like 60 to 70%. And it's a public school, but they all live in that area. And so well supported. The kids just really embraced it, even though their parents didn't do these surprise pop-ups and things. I have not once seen anybody have any backlash. Yeah, I have not seen that. Yes, ma'am. Sure, absolutely.
The speaker yesterday morning had talked about offered like 4 strategies to help adolescents develop their coping abilities, like novelty and challenge, mindfulness, exercise, sleep. I'm curious about the novelty and challenge, if that's how you would see that, like you're working with teens and military families. Would that be, I guess,
I don't know if it would be, I don't think it would be very different. I think if anything, I would probably focus on it a little bit more because of the need. The things that you were doing at your previous base or previous installations, do more of that. Don't attempt to kind of change the things that have worked for you because you're in this new place. And that's something I see with a lot of teenagers. They get to a new position or a new place and they kind of have this, I gotta go shopping. I need to buy these new things. I have to have, like, it's this mind frame of, I need to start over. No, the same person you were there, the same things you wore there, the same music you listened to there, you're allowed to have that here. Don't feel obligated to have to present as this brand new person. That's one of the things I've seen, which goes along again with those identity issues. They've moved so many times and had to quote unquote start over so many times. You think about what regular teenagers deal with as a part of just being a teen. Image. What do I look like? Everybody sees my pimple. I can't wear these shoes, they're not in style. So that's one of the things that I've seen a lot with teenagers, not only military teens, but with my foster teens also. Trying to kind of create an image where I'm fine, you know, I'm just like everybody else. There's no problem. You know, my dad's not deployed. I haven't seen my mom. Like, there's no issue. So really working on them to cope with the idea that what they're dealing with, while unique, is okay. They're allowed to be sad when they need to be sad, or irritated when they need to be irritated, and not feel like they have to put on a facade in order to make friends. We talk a lot about that. Images, body issues, what was acceptable at another place that's not acceptable here. For teens, that might be the bulk of that conversation, and trying to fit in. Yes, ma'am.
So do you find if they learn positive coping skills, and when they move to the next phase or the next home, are they able to kind of hold on to that, or is it the kind of, I'm starting over?
What a typical kid is the kind of I'm starting over until someone says, you remember when? And they go, oh yeah, that did work. Oh yeah. Typical kid, right? You remember. And yeah, that absolutely works. So there have been a couple of families that I've worked with here recently, about the last year or so, that every time they PCS, they go to counseling together as a family. Just to come together and say, hey, we're moving again. How is this going to affect the unit? And I was like, man, that's brilliant. But because of it, the kids have kind of been, they know what to say. Oh, yeah, we're going to just be ourselves. We're going to do this. We're going to do that. And, you know, we're going to be nice. And, you know, and they kind of just, it becomes this kind of mocking thing. But in all honesty, it benefits them because they've learned it and they've done it so many times. When they get to the new spot, it's not this sense of, oh, my gosh, I got to change. Oh, my gosh, I'm scared. They're not going to like me. They don't wear their hair like this here. You don't see a whole lot of that because they've kind of had those instances before. And I thought that was brilliant on the behalf of these parents to know that, hey, this move's going to be difficult for these kids. Let's see what we can do to make it easier for them. Is that the norm? No. But if they have learned these positive skills, if somebody reminds them, it comes back. I've seen that, definitely. Did you have your hand up, ma'am? Oh, okay. Yes, sir.
As far as that being yourself, people talk about that a lot, and I remember reading this book that helped me kind of see more from the teenage perspective, you know, because you forget, like you said, you forget how it was. But and it was a teenage girl, you know, so I was never a teenage girl, so it'd be nice to know, you know, what it's like. It's called Letters to a Young Sister.
By Hill Harper?
Yes.
Yeah.
Yeah, that was really good.
Yeah, I've purchased that book 6 or 7 times over and gifted it to clients, teens that were getting ready to leave or move. Yeah, that's kind of my little standard go-to. He has one, Letters to a Young Sister, and Letters to a Young Brother, I believe. Yeah, they are really good books, real good. And there are all those books that they're empowerment, but it's written on a level where 14, 15, 16-year-old could read that and take something from it. Very good. I made it, Jesus. Okay. Whew. Thank you guys so very much for being attentive, for participating. I appreciate you. Thank you very, very much.